much, everybody, for being here. This is another version of our CEO Insights. Today, we are interviewing Dr. Todd Eibes with Iowa Weight Loss Specialist. So thank you so much for being here. Appreciate it.
Thank you for having me.
So tell us about Iowa Weight Loss Specialist. I have a feeling I know what you do, but tell us the full details.
I mean, the name grabs you and people come in because they want to lose weight, but really we're a comprehensive team dealing with metabolic disease. A lot of diseases tied to obesity, diabetes, high blood pressure, sleep apnea are really an epidemic right now, and it's the obesity that is driving this epidemic.
Wow, so sounds like you can help a lot of people then.
Yes, we have multiple options. We have medical and surgical options. We can do anything from metabolic rate testing to meal planning to talking about the new medications that are available, or we can discuss surgical options where I'm the surgeon, do sleeve gastrectomies, but we have a whole comprehensive team to help.
Got you. So you may not have to go invasive, or you can. You have the whole full spectrum.
Yeah, the vast majority of people really don't know what they want to do at the beginning. And so we ask them, just come to our website, just start learning about things. At iowaweightloss.com, they can get a lot of information and start thinking about the options. And they'll identify whether they have diabetes or sleep apnea, what are my options for this? And our team can start to work with them and formulate a customized plan. We're not a believer in a one-size-fits-all. Maybe people have an eating disorder. Maybe they just need medications to help them. Maybe they've exhausted all these avenues and need to talk about surgeries.
Wow. Do you see a fair amount of athletes too that want to kind of up their game with their weight because they want to be the best in their field, which I know a lot of athletes are struggling with their weight. It's a big part of accelerating in that area.
I would say the majority of athletes that we see are former athletes.
Okay.
There are people that when they were in their 20s or teens, they were athletes, and maybe they played football and have gained a lot of weight, and now they're 40 years old and they're 100 pounds heavier, and now they have diabetes. And so we see a lot of that, even NFL players after they retire. Many of them have difficulty with their weights. So we see that a lot more than at the younger ages coming in.
Wow, that's amazing. What a great service you have. So tell us about the clinic itself and how it got started. Curious about your origin story.
Sure. So I did my training at the University of Iowa quite a long time ago, and Dr. Edward Mason is considered the founder of Bariatric Surgeon in the United States.
Wow.
And I had the privilege of working with him some there and saw some of the patients that he dealt with. So my interest got sparked a long time ago.
Cool.
And then when I came out into practice, I started practicing in Grinnell many years ago in around 1999.
Wow.
And my practice originally was general surgery, but I enjoyed doing weight loss surgery. And as time went on, I just got more and more into weight loss. And I feel like if I use my skill to help control their appetite, I have great opportunity to cure their diabetes, high blood pressure, and sleep apnea. And it just grew and grew. And then my vision was I wanted to have a comprehensive team. Because it does no good if I control your appetite, but you're eating because you're depressed or have some kind of mental health issue, or you hate your spouse, you hate your job, they're working the night shift. There's so many factors. So that's why we have a medical team of dietitians. We have a psychiatric team at the office to help with all of these issues, because maybe I can cure your appetite, but we've got to deal with how do you deal with stress, for example.
Sure. Oh my gosh, that's amazing. I mean, back in the day, I'm a former ballerina, and we were not allowed to eat. I mean, and so a lot of us had anorexia and eating disorders and problems because we were like, we've got to be perfect, right? So, I mean, it affects so many different people.
Sure.
It's amazing.
And I think the biggest aspect, I think a lot of people don't realize the psychological impact of being obese. I mean, they'll go into a store and people won't help them because of their weight. And internally, they believe that they're worthless. They feel bad. They know that they're overweight, and they know what they're supposed to eat. But they can't control their hormones, their genetics. There's so many factors controlling their weight. And so while I can help them with that, how do we repair the 10 or 20 years of psychological damage they've had? Because they are so frustrated with how they've lived.
That is amazing. How big is your team then that you have?
Oh, I have 7 nurse practitioners, 5 dietitians. We have 3 mental health providers. I'm the only surgeon. I have a physician's assistant who just helps me with the surgery. So last year I did 350 surgeries, and we probably see 200 to 250 medical patients every month.
You are saving people's lives, like mentally, physically. You're helping them have a better life. I mean, this is an incredible service. I want to cry right now. Like it sounds incredible. Like you are literally changing lives. It's
Yeah.
amazing.
I love it. Again, it's not the weight loss. But it's fun to
Yeah,
hear the
it's-
stories when
yeah.
a year later, well, I actually operated on my second cousin a year ago.
Oh my
And he was sending us pictures. He was cliff diving last weekend in Jamaica.
Cool.
He's lost 200 pounds in the last
Oh
year.
my gosh.
And when you look, he used to be a basketball player and an athlete.
Okay.
But his weight got out of control. When you hear their stories of they can't ride the rides at Adventureland, they can't shop in normal stores, they
Yeah.
can't do this, it's remarkable.
Well, Iowa, the state has a huge initiative around health, the healthiest state, right? We want to be one of the healthiest states in America because we know we don't rank very well within our health and our health outcomes. So do you partner with the Healthiest State Initiative? Do you do some things with them and other organizations to help get the word out about the great work you're doing? 'Cause-
We're happy to work with any type of other organization that
Yeah.
wants to. We don't specifically use, say, one fitness program or partner with one gym or anything like that. But we like to partner with any of these people that want to work with us. We're happy to. Because maybe CrossFit's right for you. Maybe Farrell's is right for you.
Yeah.
Maybe Lifetime's right for you. But we need to get into the underlying issues of what are your genetics? Why are you in this situation? How do we move forward? And then once I can help them control their appetite and we deal with the psychological, then all of these other initiatives and businesses will benefit from that and do better.
Well, and from a workforce perspective, you have a better worker at your company because they're feeling better, they're probably
Absolutely.
performing better,
Yeah.
because they're just, overall, their whole health is
Absolutely.
better, so.
I always like to go to businesses and talk to their HR and say, okay,
Okay.
Wells Fargo, for example,
Mhm.
you have a lot of employees. What if we cure half of the diabetes in your organization? What will that do for your healthcare costs?
Oh my God.
So those are the things to think about. And now we have the new medications that are challenging because they're expensive. The new
Mhm.
GLP-1 drugs you see talk about Ozempic.
Yeah,
and
everybody's talking
Mounjaro.
about it, I know.
It's the hot topic.
It's the hot topic, yeah.
And it's expensive. However, long-term, these drugs are gonna change their appetite. It's gonna control their obesity. So instead of having somebody on insulin for 20 years, maybe we just cure their diabetes and they don't need it. And I think as time goes on, these things are gonna get cheaper and cheaper. I always tell people we're kind of in a renaissance right now.
That's amazing.
We have great surgery that's lower risk than having your gallbladder out, or we have medications that can control your appetite. So it's really, there's a lot of options out there.
Oh my gosh, that's incredible. That is absolutely incredible. So when did your organization start? What year did you start this?
So with Iowa Weight Loss and Iowa Specialty Hospital partnered together,
Mhm.
that's been in existence for 9 years.
Okay,
I've been doing weight loss for 20 years, but our current
But the current-
organization is
okay.
9 years.
So still kind of fairly new in a way, like you have a long way to go. What are maybe some expansion plans in the next 10
Well,
years,
we
20
ju-
years look like?
We just opened a 28,000 square foot office. So
Okay.
every 3 years, we keep opening a new office. So I joke with the CEO, man, if we get any bigger, we'll take over a building downtown. So
Okay.
we'll see from there. But we have a lot of room that we can continue to grow. But I think what's gonna happen, these medications are gonna change the world.
Mm.
Because they're gonna give people the non-surgical option that they at least wanna try.
Yeah.
And as they become more cost effective, we're gonna grow. I mean, I could see a point where 20 nurse practitioners and 20
Sure.
dietitians just dealing. And it's gonna be more of a routine thing. Instead of having such a stigma about getting your obesity treated, this is just like any other disease, and we need to treat it so that we can eliminate all these other problems.
Yep, and, I love that mental health now it's okay to say, there's a mental health crisis in America, right? It's become
Absolutely.
more normalized. So just like obesity and weight loss and things like that. So, I like that people are being upfront, they're dealing with it,
Mhm.
right? And that just helps for a
Sure.
better America.
Yeah, for many
So-
years, all of our patients have heard, you know what to do, move more, eat less, put down the fork. Well, when you
It's
have
not easy.
hormones that are regulating your appetite and you go on any diet program and these hormones go sky high, telling you that you're hungry, how do they overcome that?
Yeah.
But if I do a surgery and I cut those hormones down to 20% of what they were in the past, now they're just not hungry. Most of our patients after surgery may eat 1,000 calories a day, feel totally fine. But if I tell people to do that, and they're 400 pounds and come in, I say, let's do 1,000 calorie diet, they're gonna feel like they're dying.
Mhm.
So that's where we've got to get the stigma off and really treat the metabolic and medical issues and then go from there.
Wow, that's amazing. So what do you do in your spare time? It sounds like you're really busy, you're
Yeah.
expanding, you're growing like crazy.
Yep.
What do you do in your spare time?
Well, I don't know if it's because of the weight loss. I just love fitness. So I work
Yeah.
out a lot. I do
Okay.
a lot of weightlifting. And I always say I want to keep up with my kids and things. I have a 24, 21-year-old and a 13-year-old.
Oh.
So I love snowboarding, golfing, things like that. But I think you want to have, just like our patients, if they want to ride the Rise to Adventureland, I want to have experiences in life.
Mhm.
So I'm standing on a mountain in Colorado snowboarding. I think that's fantastic.
Yeah.
So I want to be fit so I can do those things.
That's amazing. So if you could say something to your younger self, any advice that you maybe would give to your younger self, what would it be?
Oh, that things are going to be okay. Maybe sometimes you have doubts, or is this going to work out, or is this the right path? And I've always been willing to take chances. And it's scary when you take chances. Like when you open a new business, we're going to go down this path. And I just like fighting for the underdog. So I like the fact that our patients have been discriminated against, so I can provide this for them. So maybe my younger self had doubts or was worried about this, but it all worked out. Everything's fine.
That's incredible. Well, congratulations on all your success. That's amazing. So we always we want to ask, tell us about West Des Moines. What do you love best about West Des Moines? Why West Des Moines? Sell us a little bit on West Des Moines. What's your favorite thing?
Well, there's so many great businesses and places, and it's growing so fast.
Yeah.
All the new opportunities and stuff. Compared to, I grew up in a small town, Burlington, Iowa, the southeast
Okay.
corner, and there's just so many more businesses, opportunities, things to do, places to eat, and I just love that. So I think it's great, and all the expansion coming in is fantastic.
Yeah, it's amazing.
So
Next
it's-
couple of years is going to be
Yeah.
really, really fun.
Yeah,
So,
it's becoming a real big city.
Oh,
Lots of amenities and
yeah.
things that you just don't see. So I love it.
It's great. Well, thank you so much for your time. Really appreciate you being here on our CEO Insight series. I've learned a lot. I hope this brings a lot more business to you, and just a really, really great opportunity to learn more about you. Well, thank you so much for joining us at this episode of West Des Moines Chamber of Commerce's CEO Insight series. And remember, go West. Thank you.